Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And very good morning. Yang berhormat Major General Bersada Datuk Paduka Seri Haji Aminuddin Ihsan bin Pehin Orang Kaya Saiful Muluk, Datuk Seri Paduka Haji Abidin, Minister at Ministry Culture, Youth and Sports, Brunei Darussalam. Her Excellency Ms. Tiffany MacDonald, Australian High Commissioner in Brunei Darussalam, as the guest of honors for today's event. Our special guest, Yang Berhormat Dayang Khairunisa binti Awang Haji Asari, Member of the Legislative Councils. Yang Mulia Pangeran Dr. Haji Muhammad Khalifa bin Pangeran Haji Ismail, Director General of Health Services, Ministry of Health, Brunei Darussalam. Yang Mulia Puan Hajah Zainab M.A. Omar, Brunei Shell Petroleum Human Resources Director. Yang Mulia Captain Haji Khalid Khan bin Haji Asmah Khan, Chief Executive Officer of Royal Brunei Airline. Yang Mulia Mr. Sean Hun, Founding Curator of Global Shapers Community Bandar Seri Begawan. Yang Mulia Dayang Hajah Nurajlin Uminatul Hafizan bin Haji Alimas, Founder of Kyohat, Counselor at Clarity Sendirian Berhad, Mental Health and Addiction Coach, and the Event Director for Brunei Darussalam World Mental Health Day 2021 celebration. Participants, Organizing Committee, Event Partners, Supporters, Sponsors and Media Friends, I am Awangku Abdul Farid of Royal Brunei Airlines as your MC for today's event. A very warm welcome to the virtual opening of Brunei Darussalam World Mental Health Day 2021. To commence the event and to bless the event, we would like to invite Yang Mulia Ustaz Farizal bin Ali for the recital of Surah Al-Fatihah and Doa.
أستغفر الله العظيم الذي لا إله إلا هو الحي القيوم وأتوب إليه. أستغفر الله العظيم الذي لا إله إلا هو الحي القيوم وأتوب إليه. أستغفر الله العظيم الذي لا إله إلا هو الحي القيوم وأتوب إليه. إلى شرف النبي المصطفى رسول الله صلى الله عليه وسلم وآله وذرياته أجمعين، وخصوصا في هذا المجلس وبركته أوله وآخره وما بعده وآله وأصحابه الكرام. الفاتحة. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. آمين.
Amin, amin, ya Rabbal Alamin. Without further ado, the event would like to invite Yang Mulia Dayang Hajah Nurajlin Uminatul Hafizan bin Haji Alimas to deliver her welcoming remarks.
To the Honorable Major General Datuk Paduka Seri Haji Aminuddin Ihsan bin Pehin Orang Kaya Saiful Muluk, Datuk Seri Paduka Haji Abidin, Minister of Culture, Youth and Sports, and our guest of honor. The Honorable Tiffany MacDonald, the Australian High Commissioner. The Honorable Directors, Sponsors, and highly respected guests. Assalamualaikum warahmatullahi wabarakatuh. First and foremost, on behalf of our sponsors and committee members, we would like to extend our deepest gratitude to His Honorable Datuk Seri, Minister of Culture, Youth and Sport, for his attendance as guest of honor. We hope His Honorable Datuk Seri presence will be the catalyst and the motivation for our patients to continue to help those in our community, especially those who are primarily in need of support from the field of counseling and psychology. Our Honorable Datuk, in conjunction with World Mental Health Day, in association with multiple agencies, Curhat, Global Shepherds Community Brunei, took a consultant and Clarity as this event's host. Alhamdulillah, through this cooperation, we hope that this event will be the stimulus towards better awareness of the importance of caring for mental health and among our communities. Mental health is often taken lightly, with people prioritizing physical health without understanding the importance of caring for one's mental health. Both of them possess a vital role in our life which requires balance, which contributes to individuals living harmonious and fulfilled lives. In this event, we have curated 3 forums, 7 workshops, and 7 support groups, which will iterate the importance of mental health. I hope that this creates a motivated community in caring for mental health. Our Honorable Datuk, counseling and psychology services play a significant role to help those who are enduring a crisis or behavioral, mental, and emotional issues. Professional counseling can shape an individual into becoming more rational and mindful. We have seen the impact of COVID-19 on the world and its significant impact and effect on humans within and outside the country. It has caused anxiety, stress, depression, concerns towards financial matters, unemployment, and social disturbance. I hope that everyone's support and faith in our community towards our services will help prevent harm that can negatively affect their mental health. Inshallah, our counselors and psychologists will work hard together, help those that are in need in order for our society to be more productive and harmonious. Before I end this speech, I would like to extend our deepest gratitude to our Honorable Datuk for attending this event alongside as guest of honor, as well as for supporting and making our event possible. I would also like to take the opportunity to extend my gratitude to our community members for together making this event possible. Not forgotten are our donors and sponsors who are willing to support us either through financial or in-kind support. To our speakers, we hope that whatever you contribute will become a good deed that lasts until the end of time. Lastly, let us hope that we all receive the greatest benefit for together helping those in need. Amin, amin ya rabbal alamin. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Thank you.
Alhamdulillah. Thank you, Yang Mulia Hajah Nur Ajlin. Now, the event would like to invite Yang Berhormat Major General Bersara, Datuk Paduka Sri Haji Aminuddin Ihsan, bin Pihin Orang Kaya Saiful Muluk, Datuk Sri Paduka Haji Abidin, Minister at Ministry of Culture, Youth and Sports, to deliver his speech.
Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alamin. Wassalatu wassalamu ala ashrafil anbiya wal mursalin. Sayyidina Muhammadin wa ala alihi wa sahbihi ajma'in. My esteemed colleague, Yang Mulia Hajah Nur Ajlin Uminatul Hafizan, founder of Curhat. My good friend, Her Excellency Miss Tiffany McDonald, High Commissioner of Australia to Brunei Darussalam. Members of the organizing committee, even speakers, mentors, moderators, sponsors, and especially to all of you, participants of this year's editions of the Brunei Darussalam World Mental Health Day program. Assalamualaikum warahmatullahi ta'ala wabarakatuh, and a very good morning. It is an honor to speak to each and every one of you today. Thank you so much to Hajah Nur Ajlin and all our friends, organizers, speakers, moderators, mentors, sponsors, and all of you here for realizing this important event and for making such a difference to your organizations. We are very proud of all of you. To Your Excellency, the High Commissioner of Australia to Brunei Darussalam, thank you so much for your presence and support. We appreciate all of you have done for mental health awareness and more in Brunei Darussalam. Mental health is no longer the taboo subject as it was before. Its ever-increasing acknowledgement is reflected not only in our national agenda, but also as one of our deliverables during Brunei Darussalam Championships of ASEAN this year. All of us are aware that there is no health without mental health. All of us are aware that mental health concerns everyone, and most important of all of us are aware that mental health is a real issue in Brunei Darussalam and beyond. This is why the work and advocacy that has been done by everyone present today is so important. To name a few, only on Wednesday, Her Excellency John Yang Hormat Dato' Erwan for the Australia Brunei Darussalam Civil Service Mental Health Symposium, and since last month, Her Excellency with partnership with the Blue Raincoat Collective, Curious Mind, and many others started the Mental Health Matters Month initiative, kicking off the Not Alone, Let's Talk series and Okeykah Kita program touching on many challenging issues openly. The Young Professionals Network also organized a virtual dialogue on resilience in times of uncertainties, an open platform for all to discuss these critical issues. These and many more throughout the year shines a spotlight on an ecosystem that is stronger than ever before. This is an ecosystem that recognizes mental health is at the core of our well-being, the foundations that enable us to lead fulfilling life and to participate fully in our community. An ecosystem that is needed now more than ever before with the current wave of COVID-19. Since the outbreak of the pandemic, statistics shared by the Ministry of Health show that in the past year alone, psychological services in Repast Hospital receive an average of 400 to 500 patients every month. At the same time, Talian Harapan 145 recorded more than 700 calls in August this year, a significant increase from its previous average of 200 calls in a month. And even without the pandemic, around 1.5% of the national populations are affected by mental illness. The question we must ask ourselves is, how can we direct these statistics into continuous action? This is what Brunei Darussalam World Mental Health Day Awareness Program is all about. Let me take this opportunity to highlight one best practice we can learn from our ASEAN neighbor, a one-stop portal for mental health resources. Not only will this portal function as a reliable resource center curated by mental health experts, it was a key recommendation to ensure the access of credible content for individuals seeking help. This is seen as a critical factor to remedy the psychosocial effects of COVID-19 and just as important to address the overwhelming surge of information surrounding the pandemic. Ladies and gentlemen, in the next 3 weeks and beyond, let us challenge ourselves to ensure how our own ecosystem will deliver mental health to all. How can we build on our achievement? How can we synergize our effort? How we can reach out to even more individuals? And most of all, how do we ensure no one is left behind, especially in the pandemic? Towards this, we need to consider how organizations and institutions can initiate this development through strengthening and changing their policies alongside individual effort. This is the fundamental change that will send a strong message that mental health is everyone's concern. On that note, it is important to transform policy into practical actions, amongst others through support groups. This necessitated us to develop a matrix to measure success, a critical factor for lasting change. Towards this, let us continue to do our part and more. Together, let us tackle mental health in an unequal world. And ultimately, as we envisioned in our ASEAN team this year, let us care for each other. Let us prepare for challenges together. And let us prosper together in the new norm where no one is left behind, inshallah. I wish all of you the very best and have a good and meaningful 3 weeks ahead. Do stay safe. Thank you. Wal taufiq wal hidayah. Wassalamualaikum warahmatullahi taala wabarakatuh. Thank you.
Alhamdulillah, and thank you Yang Berhormat Datuk. A very impactful speech by Yang Berhormat Datuk for our youth and also our nation. Moving on, the event would like to invite Her Excellency Miss Tiffany McDonald, Australian High Commissioner in Brunei Darussalam, to deliver her speech.
Selamat pagi, selamat sejahtera. It's my great pleasure to be here to have the opportunity to support local mental health initiatives in Brunei. I would like to acknowledge Yang Berhormat Major General Dato' Paduka Seri Haji Aminuddin, Minister of Culture, Youth and Sports. I'm proud to speak about this important issue alongside you today, and I look forward to continuing to work with your ministry to address mental health. I'd also like to thank Puan Haji Nora and our friends in Pure Heart, who have been strong supporters of the Australian High Commission's Mental Health Matters Month, which ends today on World Mental Health Day. In many ways, COVID-19 has made it more difficult for us to stay connected, but as close friends, Australia and Brunei have continued to work together to make a difference and address the impacts of COVID-19. Australia was pleased to contribute 100,000 Australian manufactured AstraZeneca vaccine doses to Brunei last month. Experts from Australia's Department of Health have met with counterparts in Brunei's Ministry of Health to exchange views on a range of issues related to COVID. We are delivering training to counter COVID-19 disinformation, and Australia has provided laboratory equipment to Brunei. We have been pleased to support Brunei's frontliners through working with organisations such as the Society for Community Outreach and Training, and my colleagues have rolled up their sleeves to donate blood to the Rippers Blood Centre in response to the call for support. These have all been very important and well-received contributions to the physical impacts of COVID. But we have also recognised the importance of working together to address mental ill health. At the ASEAN Australia Summit last year, His Majesty the Sultan of Brunei stressed the importance of strengthening healthcare systems for the future, including through safeguarding people's mental health. Our Prime Minister, Scott Morrison, responded immediately, echoing His Majesty's sentiments. Depression is one of the main causes of disability worldwide, with a US $1 trillion loss each year due to the loss of productivity in the workplace caused by mental ill health. Worldwide, more than 700,000 people die due to suicide each year. It's a very sad fact that suicide is the main cause of death for Australians aged 15 to 49. In Australia, we are investing significantly to turn this trend around. But mental ill health has and continues to be exacerbated by COVID. The fears and uncertainties caused by the disease, but also the impacts of the lockdowns, isolation, and economic effects are all compounding the negative implications of COVID. It is therefore apt that people have described mental ill health as the shadow pandemic. Now, more than ever, it is important that we talk about mental ill health. We need to look at the issue holistically and realise that addressing mental ill health will not only improve the health outcomes of our communities, but will ensure people are empowered to effectively contribute to our societies. I am extremely pleased that the Australian and Brunei governments have prioritised addressing mental health through the ASEAN agenda. What better way to respond to Brunei's ASEAN Chair Year theme? We care, we prepare, we prosper. As ASEAN's oldest dialogue partner, Australia is proud to be supporting the Brunei-led East Asia Summit Leaders' Statement on Mental Health Cooperation and a subsequent workshop. We are working with ASEAN to connect young people and NGOs from across the region, while working to address mental ill health. We are also working together bilaterally, Australia with Brunei, on this important issue. We have connected the Ministry of Health, Talian Harapan 145, with counterparts at Lifeline Australia, which provides 24-hour crisis support and suicide prevention services. We are running a mental health youth champions program to empower young people in Brunei to start conversations in their commitments, thereby reducing the stigma. And just this week, we brought together over 75 participants from across Brunei's civil service to discuss how we, as the government, can effectively tackle this public policy issue and foster mentally healthy workplaces. Today, we come together to mark World Mental Health Day. I hope that through this program, organised by very dedicated teams of Pure Heart, Global Shapers, Pekka Consultants and Clarity, that you go away with new ideas on how we can collectively and individually reduce the stigma associated with mental health and make a difference in our communities. We want to generate a conversation that leads to good understanding amongst community members about mental ill health, but also that we create the policy frameworks and the resources necessary to ensure that those who are struggling, who do need support, have the capability to reach out and get the support that they need. So thank you all for participating today. Thank you to Pure Heart and friends for making the event happen today. We're in this together and we're delighted that the Australian High Commission has been able to lend its support to your program today.
A big thank you, Your Excellency, for the insightful speech. Now, the main highlight of the event. The first forum for Brunei Darussalam World Mental Health Day, Mental Health Education and its Realities, moderated by Yang Mulia Awang Fadli Zaini, Shaper and Convener of Global Shapers Community, Bandar Seri Begawan, and the panelists for the forum is Yang Mulia, Mr. Todd McPherson, Counseling and Psychologist at Clarity Sendirian Berhad, and Yang Mulia, Dr. Hilda Ho, Consultant Psychiatrist and Head of Psychiatry Services, Ministry of Health, Brunei.
Thank you very much, Farid. Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. A very good morning, everyone. I would like to just do a very quick ice-breaking, as much as I'd like to make this session as interactive as possible. But first, let me just address a few friends. Yang berhormat Major General Besar Datuk Paduka Seri Haji Aminuddin Ehsan bin Pehin Orang Kaya Saiful Muluk Datuk Seri Paduka Haji Abidin, the Minister of Culture, Youth and Sports, and Her Excellency Ms. Tiffany McDonald's High Commissioner, Australian High Commission. I also noticed some of our special guests who are here today. Yang berhormat Dayang Khairunisa binti Awang Haji Ashari, a friend, member of the Legislative Council, as well as other dear guests who are here today. Welcome to the first forum that we'll be holding for our first 3-week program. I'm very quite excited. Otherwise, I'd like to also recognize the audience who are here, those who are on Zoom and those who are watching with us on YouTube. If you could just help participate with me with just giving me some reactions, if you could just give a clap hand, maybe a thumbs up. So I'm just doing something there. Okay, I see some thumbs up there from Todd. I see one there, another from RB as well. Hello everyone. Maybe if you could just say hi on the chat box for me. Maybe just say where you're from. So I'm from Kampong Sungai Basar, live from Kampong Sungai Basar. Very proud. Just the Kampong just before the bridge. Hello. Hi everyone. Hello. Hey, from Ragong as well, from Z. Please keep on sharing as well. I'd love to know where you guys are from. I know we have a lovely demographic here today. Majority of you guys are students, some professionals who are educators, psychologists, management professionals, those in the public sector as well, and others, including NGO leaders. Ladies and gentlemen, welcome to this session. So just some housekeeping notes. Nice, I see a live chat coming in. Just some housekeeping notes, ladies and gentlemen. I'd love to make use of this engagement as much as possible. This forum is also about a sharing session from our fellow speakers, but also from you as well. We'd like to make use of the hand raise function. So I'm just going to try that right now. So that's a hand raise. And then and you can lower your hand as well. You can also give some reactions throughout the session. Use the chat box as well. I will also have my colleagues just spotlight the screen briefly for the Slido that we'll be using as well for those who are a bit shy. But I will prioritize those who will be asking questions on the mic and on camera, just to make this as organic as possible. So ladies and gentlemen, this first forum is quite important and quite an entry to this first 3-week program. So we have a panel we have the session that is titled Mental Health Education and Its Realities. It's quite a broad topic, and we have two lovely speakers already here with on the spotlight. But let me just give a setting scene, for this session. So education, as it is an important cornerstone for all discussions that we've had. I think I recognize the remarks by Yang Berhormat Datuk KKBS, as he mentioned the work that we did in the impact dialogue. We have also some speakers that were here in the previous session on looking how we can create impact literally and using some of these outcomes and outputs immediately. And this is a nice follow through to that. Also, as well, from Her Excellency Ms. Tiffany on the mental health resources and seeing how this realization from the mental health champions into materializing this sort of initiative. But in any case, for us to address these stigmas and to look at how not just in the institutional levels of society in addressing and achieving these initiative of an educated, highly and accomplished people, I think it's also how we can tackle it individually. But in all else, I think in my previous conversations with Todd and Dr. Hilda, I'm very honored to hear that young people are making a huge impact compared to where we are here today, but much more work to be done. So I will cover the format for this session. And please correct me if I'm wrong, organizers. I know we were supposed to start at 10:30. It is now 10:39. We will have about 1 hour and a half. So please correct me if I'm wrong. Just message me offline. So what will happen is that I will just say hi to our first two speakers first. We'll have them introduce their insights and perspective about themselves and as well as on the topic. And then we'll see how we can break this down into 3 separate sub-themes. We know mental health education is quite broad. So we'll look at it in an institutional level, social cultural level, and an individual level. Although these sub-themes are cross-cutting, it doesn't mean we have to come back to that. But we would like you participants to come in as soon as the 15th minute of this conversation. So I've just confirmed it is indeed 1 hour and a half. So I will respect the time. So it is about 10:40. We will end about, my maths is failing me. It's about 12. So I will now pause on myself. But I think just one last bit. I would like to just introduce myself as Fadli, and today I'm a shaper. I think it's been a wonderful time to work with the Global Shapers and to credit the wonderful team behind this. And a special mention to Jia Cheng and Nasri for designing today's format of the session and working together with our speakers where we called last Thursday. And very, very honored to be continuing this conversation with our 148 plus participants from our Young Professionals Expo event to today. And a very, very happy Mental Health Day, everyone. So first and foremost, let me pause on that and come back to our speakers. I will, Todd, allow me to say ladies first. We have a wonderful lady with us. Dr. Hilda, you've just had a recent talk under the collective. I think I had the honor of just listening to you in a bit. And I think if anyone...
Thank you.
You are not without any introduction. You're the head of the psychiatry services and someone with a wealth of experience, and very much looking forward to see how you can share your own insights and maybe even continuity from a conversation from what you've had in the collective. But otherwise, I'm just going to pause there and give the floor to you. Dr. Hilda.
Thank you very much, Fadli. I'm really honored to be here this morning, and I'm so pleased to see this event that's been organized and so many participants. It really is great to see. So I'll introduce myself. I'm Dr. Hilda Ho. I'm a consultant psychiatrist, which means that I'm a specialist doctor who helps people with their mental health. I am also the head of psychiatry services in the Ministry of Health. I've worked in mental health for more than 20 years, And for the past 10 years, I've worked with a fantastic team of colleagues in Brunei to improve standards of treatment and services, and also to improve mental health awareness. And I'm delighted to see so many people from the public, from NGOs, who have now sort of got on this bus to improve mental health awareness. So it's great to see. When I look back, I think that the key milestone in our work was the implementation of the mental health order in 2014 that I drafted with colleagues from the Ministry of Health and the Attorney General's chambers. I believe that this was the turning point that led to the inclusion of mental health policies in public discussion. In the past few years, we've also established various training programs in mental health, working together with the Institute of Health Sciences in University Brunei Darussalam. This has led to an increase in professional mental health expertise in our country. I also have a strong professional interest in public education, research, and quality improvement. I am very encouraged to see an exponential growth in mental health awareness, knowledge, and public discussion regarding the crucial importance of mental health in our society. I feel extremely honored to be part of this World Mental Health Day event that has been organized by so many groups and individuals. I am inspired by your innovation, enthusiasm, and hard work, and I'm really excited to hear from speakers and participants today. Thank you very much for inviting me, and I'll pass it back to you, Fadli.
Thank you so much, Dr. Hilda. I think that's a good introduction, and well, not so much how you could cram decades of experience into that, but I am really looking forward to see how this could be something we can look more on the not just for the shorter term, for the longer term, how we can look forward to this for everyone who is here to take advantage of this this forum to see how we can play a part of that. I think one of the objectives is also to explore deeper conversations, how we can build that, but also gauging on the current landscape. Anyway, I'm going to pause on that as well to introduce our second speaker. Yeah, let's give her a warm round of applause. Thank you, Shahira, for that. Otherwise, I have the pleasure of introducing a gentleman that I've met a year ago today, actually, at the aviation school, where we actually had a mental health celebration then. And today meeting, it's like jodoh, it's like fate. But as a counseling psychologist, as opposed to Dr. Hilda's in the public sector, Todd is, I understand, a Canadian, but has been here. I would like to say bred Bruneian as well. And in any case, working with a wonderful team at Clarities Nir Bahad as one of the co-organizers here today. Todd, the floor is yours.
Thank you, Fadli. Thank you, everyone, for coming. It is, I guess, so honoring just to have so much support from our dignitaries, from the NGOs, from the corporate sector, and of course, the public. The fact that people are interested, are willing to listen, are engaging in mental health discussions it's really heartening, and it's going to just create further positive change. As you mentioned, I arrived in Brunei in 2003. I was trained in Canada as a counseling psychologist, and when I arrived, my hope was to bring my expertise here and to bring some counseling to the general public. Prior to that, the way people had to access mental health services was generally through hospitals, through the government, slightly intimidating ways to receive help. And so what we've really focused on for the last 17 years was trying to provide avenues for average people, generally well-functioning people to receive help, to receive guidance, to receive support and counseling, without having to go through maybe health channels, official channels, government channels, and I guess provide other alternatives. And what we've seen is just that over the years, the number of people who have begun to be aware of this, to think it's a good idea, to not see it as a weakness to seek help, that has changed so much. So Brunei is changing, and if this growth, if this change can continue, especially through events like this, I'm very excited to see what will happen in another decade. Thank you.
Thank you, Todd. Lovely introductions from both of our speakers. Thank you for the warm round of applauses that I've been receiving via chat box, as well as the reactions. Thank you for participating as well. And those who are just joining in us on stream on YouTube. I am I would like to recognize that it is really a huge pleasure to have a big 84 there and our participants group, and to have those who are joining us on YouTube. I'm sure there's a huge number there as well. And kind of putting this in together. And I was actually just looking at Slido. For Dr. Hilda, Todd, don't worry, I'll help to moderate and manage the questions as we've spoken about. But I enjoy and love that the first question that just came in literally on the Slido there was how can the panel elaborate on unequal world? It's a good recap to remind everyone today's theme for today's theme is mental health in an unequal world, and that's quite fascinating. Hopefully, as a good opener, and allowing that conversation to come in a bit. But let me just emphasize the objectives for today's forum. It's to explore a deeper conversation on ways to build a mental health culture through mental health education. Education here being a keyword, gauging on current landscape of mental health education and how to overcome current challenges. And I'm sure there are many that we need to address, but also recognizing the success we've had. And lastly, a foresight of what should and is currently being done to resolve these current challenges and next steps. Stakeholders meaning every single person here in this room need to ensure a whole nation approach. It's quite a big challenge we come here today. Those from corporate leaders to those who are just people like me, young professionals or students who just graduated. I'd like to just come back to Dr. Hilda. I think that is a good first question to ask. I know we've discussed some potential questions in our Thursday call. So these are just responses that you can integrate that along with, and hopefully more questions that we could get from our audience. So that is the first question there from our audience about defining an unequal world, and what is that? Dr. Hilda, floor is yours.
Well, when you talk about inequality, you talk about all sorts of factors, so financial, personal, and your social standing in the country. But I think today it's important to remember that people with mental health problems are at a disadvantage because of the stigma that is attached to mental health problems. So I think apart from all the other inequalities that we should be aware of, we need to, I think, focus particularly on this disadvantage, that people who have mental health problems, who are struggling, have difficulty accessing help. If you compare it to physical, actually harder. And there are also other barriers that stop people from accessing help. And people with mental health problems or with mental illnesses tend to do less well in life because they don't get the help that they need. So it's this kind of inequality that I think we should focus on. What I've noticed as well is that people with mental health problems are not treated as well by society. So people look down on them. So they have disadvantages when it comes to very simple things like education, applying for jobs, success in employment, and even in social circumstances, things are not equal for them. So the question is, how do we tackle this? And how do we learn to take people seriously? So that's how I would like to start.
Thanks, Dr. Hilda. Todd, I'll just go straight into you. What do you think? And the reactions there on what is really an unequal world here, and what potentially you might be bringing up later today. Todd, floor is yours.
Yeah, thank you. My primary thought is very similar to what Dr. Hilda said, that there's a vast inequality for those who are struggling with mental health illness or disorders, and even those who are maybe not diagnosed with the disorder, but still struggling. We see this very much in terms of, as was said, education and job opportunities, and also socially. And very frequently, if someone is known to have maybe suffered with depression, families will say, oh, should you marry that person? Is that a good friend to have? So you'll actually get the stigma that seems to stick with the person. And even though they could be very high functioning, performing very well in life, there's still that idea that somehow this person is tainted or deficient. And we really need to break that and understand that people are equal, even if they're not okay sometimes, even if they struggle with mental health issues at times. The other area to, I guess, for me to be aware of and to want to share is just the access to mental health services. And what I find is a lot of times young people want to access services, but they really feel blocked. They don't have the choice that adults would have. And sometimes it can be very, very hard for young people to get acceptance from family, from parents to seek services. So that would be a key area to look at down the road.
Thanks so much, Todd. I am just looking at Slido. We have a good stream of questions coming in, but I would highly, highly encourage just to make this forum as organic as possible. If we could have a volunteer to come in and raise your hand just to share maybe just your own experiences. It doesn't have to be a question, just to give this session a bit of context. In the meantime, I think Dr. Hilda, Todd really put it quite aptly with the pattern that we're looking at, especially with current the current mental health problems that we have and how we should take into. I feel that it would be also useful to tailor this conversation to you as well, the participants, whether or not you're a professional, how you may face that in the office, or those who are students. I see a raised hand, so I'll get to you in a bit. So I also note there was a good sharing session in the previous event that I was in from professionals in the energy sector, how they handle different teams, and acknowledging the context of the COVID pandemic. And I think that's very important, especially in the second wave, or those who are students. There was a university grad student who was trying to manage his or her deadlines on that. But I'm gonna just pause on that. Just a quick anecdote. Hopefully, they'll give more the right word would be to hopefully give more inspiration for the participants to share what they may want to share. I see a raised hand. Good job. I'll have Rabi to come in. So Rabi, I love for you to just maybe introduce yourself briefly and your question or remark. I hope to hear from you. Rabi, please.
All right. Hi, everyone. I'm Rabi, and I'm a bachelor student from University of Brunei Darussalam. And I have a questions on this because we know that mental health awareness is much more touched on the youth right now. The youth are more interested to raise awareness on this type of mental health day. I just wanted to know on the perspective of the professionals, as that is it better for the education to have a counseling on having a module or even a subject on touching on the mental health, so that people are more aware and people are acknowledged that mental health is really is real, is happening in Brunei itself.
Thanks, Rabi. If you could just phrase your question, I just wanted to capture that question. I didn't quite hear that.
My question is that, do you think if Brunei should raise the awareness or even have a module or even subject on that is touching on the mental health, especially for the youth?
All right, thank you so much, Rabi. I just wanted to just capture that correctly. Thank you and congratulations on being the first person to share that experience coming from that student perspective. I see Dr. Hilda's unmuted her mic. I'm just glancing through the questions here a bit. I think there are some similar questions on I think maybe looking at maybe formal or informal education, I think from a youth sector. I think there is one here from Anonymous. It'd be great if you guys can put your names. It would be so great. But anyway, I'm just gonna share this. Okay, it has just changed a bit. But I think that it has as relating, oh no, it has, sorry, the question just went up and then now I've lost it. But in any case, we were looking at questions on fitting it in a current structure in an institution or how we can raise awareness. Dr. Hilda, I'll let you answer that.
We have been aware that mental health education should be part of teaching, and I actually personally think it should be across the curriculum. And I think there has been a growing awareness, certainly worldwide and also locally, that mental health education is absolutely necessary to keep students healthy and also to give them the skills that they need. So we have had various conversations with the Ministry of Education, and we would welcome any working together or any proposals to introduce this into the teaching curriculum. However, I must say this, that it has to be something that people want. So I cannot go in as a psychiatrist and impose my agenda and say, you all need mental health education. So very much this has to come from the ground level. People have to realize that they need it, and people have to want it and be part of it. So the ownership has to be the students and the institutions, because I think that's how it would work best.
Thanks, Dr. Hilda. It is a bit curious. I don't know if it's an appropriate time and place to start now, but what would be good first questions on how can people know what they want, especially on the ground? If I could just really give a very random pop culture example, I think we're seeing a very good, encouraging or attraction to mental health as a whole genre in Netflix, as an example. And I just finished watching It's Okay Not to Be Okay. And while entertainment aside, on Korea pop culture, it is quite interesting to see that in a perspective from one protagonist to the other. But in any case, Todd, I see your mic is unmuted. You have a response?
Yeah, I think it would be wonderful to see greater awareness on mental health issues, starting from a very, very, very early age. I would also suggest that it doesn't need to be packaged as mental health, but really a greater focus on life skills. So helping people from an early age to be more aware of social skills, relationship issues, even things like financial management, so they don't get into problems where they don't understand personal finances. To look at it from a larger perspective, and let's make sure the young people are not just equipped in sciences and maths, but really equipped for life, so that they know how to manage relationships, friendships, that they're aware of their own well-being, maybe training or more education on being assertive, setting appropriate boundaries. These kinds of things are crucial, and it doesn't need to be packaged as this is what's mental health or not mental health, but this is what helps healthy living, I suppose. Thank you.
Thank you,
Great
Todd.
question.
Thank you, Todd. I see a good hand raised there, so I'm just going to go to you in a bit, Ms. Hanani. There is some good discussion points coming out of the chat box. Emotional literacy as part of our education system as prevention. There is also a suggestion there from Zainab from a BSP, wondering if a STOT can also be introduced as an extracurricular subject as well. And if I could also echo some of the questions here, one of the more liked questions on Slido, do you think teaching emotional intelligence skills will help with our society? So I think these are really good suggestions, balance, substance on what young people or what the audience here are voicing what they want. But I'm gonna I see a hand applause there. Thank you, Kirhart. Hello, Ku. I'm gonna go to Hanani. Hanani, if you could just switch on your mic or camera or just the mic, whichever is helpful there. And if you could just test the mic, could you say hello? Assalamualaikum.
Hi, salam. Can you hear me?
Lovely. Yes, I can hear you very well. If you could just introduce yourself, a bit of a background, and what you'd like to share with us today.
Sure, of course. My name is Hanani. I'm actually currently studying a degree in psychology at Help University in Malaysia. So I guess I just wanted to share the experiences that I've had, especially considering that both Dr. Hilda and Mr. Todd himself actually made good points, especially in terms of stigma and how it's important for people to be more aware of mental health, especially from a younger age, because I feel like growing up, I didn't actually understand about the importance of mental health. And that has, I guess, not only me, but affected my other peers as well, because I've been hearing stories, not only from my friends, but from also other peers that also, I would say, suffer from not being aware when they were younger. So I think it's very important for younger generation to understand the importance of mental health as well. Especially those who suffer from either peer pressure or pressure from their parents, especially in terms of education. I feel like that's something a lot of people can relate to. And because of that, like it's very difficult for them whenever they, even from my own experience, from trying to reach out to an adult or someone like your parents or even an older generation, when they tell me, when I try to, I guess, discuss with them in terms of what I was struggling with, they would always just say like, oh, you'll get through it, you know, you'll pull through. Or maybe they'll just eventually say like, oh, just keep praying. Like the more you pray, the more that you can eventually get through. God will listen to you. And I guess like for one thing, I would say that from not only my experiences, but from what I'm hearing from other people as well, it's not just about religion and like saying that, oh, you can pull through this. Like it's more than that. Like I think that I would say the older generation also don't quite know how to start this conversation, especially with their children, from what I'm learning throughout my experiences in life with this. So I just wanted to know from both your point of views on how to, I guess, what you can share to the current generation as well as the older generation also, because I feel like it is very important, because I feel like it is also a connection in a way, because it's, because I feel like mental health has shaped the younger generation very differently, especially if compared from the current generation as well as from previous generation. I mean, even now, this is proof with this World Mental Health Forum that it has changed. And I just feel like people should really understand the importance of this, because not only does it affect your personal life, but it also affects the relationship you have as well. So I guess I just wanted your point of view on this and what you can actually say to the audience, especially from those who have experience growing up with this kind of thing and having to deal with that kind of stigma, is even from your own family.
Sure. Thank you so much, Hanani. I think that we were seeing a good flow of how we want to tackle education in different types of curriculum. And then there is the issue here, or identified challenge, where we are also dealing with different types of generation and how can we raise that awareness for that. I'm going to allow one more hand raised there. I see one lovely Puan Haja Zainab. Puan Haja Zainab was a speaker in one of my panels from earlier on, as well as a dear youth advocate friend. Puan Haja Zainab, the floor is yours.
Thank you very much, Fadli. Very good morning, Dr. Hilda and Mr. Todd. I'm very interested to hear your views. So there's this thing, right? I'm personally is a sponsor for mental health in my organization. And like everyone else who's very much into this topic, we do all sorts of things to actually give support, to show care, demonstrate that we care, and to ensure that people have access whenever they need to shout out, if you know what I mean, or to reach out. So my question is, recently I've read some papers that says, you know, there's a lot of interconnectivity when we talk about mental health, right? Things like psychological safety. And if there is no psychological safety, wherever it is, it doesn't matter if they know there's a phone number to reach out to, what people will not speak up because they're not encouraged to do so, because they're scared to do so, you know? So there's another thing that says that in order for us to actually ensure psychological safety in the workplace, then what really must be present is EQ. If there is no EQ in that workplace, psychological safety will not happen. And if there's no psychological safety, then nobody can actually reach out. So interested to hear Dr. Hilda and Mr. Stott's view on this. Thank you.
Thank you so much, Puan Zainab. I love the whole mix of conversations we're having. Even just mentioning the presence of EQ within, well, in this case, the context of a workforce is actually coming back to some of the questions we initially had about emotional intelligence. So it's a nice three at least keywords or key questions that I'll open this floor to Dr. Hilda and Todd. I think you're hungry to just respond to that. Ladies first or Todd? Whichever. I don't see a mic that's unmuted yet. Who would like to go in first?
I can go. Yeah. With the question that Hanani brought forward, which was the difficulty in speaking between generations, and especially for young people, I think part of the issue is that we don't have a language to talk about how we feel. We haven't, and certainly in my parents' generation, I think from my own personal experience, people don't have the vocabulary, and they certainly don't have the practice. So in order to do something, you need to have practice to do it well. You need to know what to do, how to do it, and what to say and what to think. So I think we don't have the skills that are necessary just to talk about how we feel and how to respond when other people tell us how they feel. And now EQ, which is emotional, I suppose it's emotional intelligence. I think it basically means, do you know how to describe how you're feeling? I think that's basically it. If what are you experiencing? Have you got the skills to be able to describe it? And when you observe other people, do you have the skills to understand what they are going through? So I think I just want to demystify EQ. I mean, that's probably oversimplifying it, but I think these are very essential skills that we lack as a society and as individuals. And it wouldn't be that difficult, I think, to start implementing education or teaching among school children and also within families, just to have short sessions, 10, 15 minutes a day with your children, for example, and ask, how are you doing? How do you feel? And even in the workplace, you could have, instead of just your business meeting with your agenda, you could have 5 minutes at the beginning. How is everybody? How are we doing in this current COVID pandemic? Everyone's working from home. Are you guys okay? Is everyone okay? And then you need the skills to listen and to respond to that. So I think it's really having skills to listen and to describe that we don't have it. And I don't think it's necessarily cultural, because I've seen this in many other cultures. And it's just something that we just haven't developed. So, I mean, for example, I play a musical instrument. You can't go from zero to playing a musical instrument with no practice and no teaching. You need to practice, you need to be taught, and then you need to want to practice, if you see what I mean. So, you have to go to the instrument and practice and keep going. So I think that's basically what I'm hearing. And I mean, personally, I think we should make it less scary, try not to use scary words, and just say it's all about communication, empathy, listening, and describing. That's me.
Thanks, Dr. Hilda. I want to just say this. I think as an individual person, even though I know this, I think I do take it for granted that, when you start a meeting, that was a good point about just putting it as an example or as an agenda to say, how are you? I think in my head, I always thought of it as just courtesy or just being polite. But I think coming into Ponaja Zainab's context about emotional intelligence, I think that is a really key part of how we can look at mindset growth as well, especially in the context of how that could be, whether it's in a soft skill or a formal curriculum. I'm going to pause here and go to Todd. I see a hand raised, so we'll go to you in a bit, F. Arifa. I'll have Todd respond to the initial 3 key points that we've just been presented by the participants. Todd, the floor is yours.
Yeah, as always, I think Dr. Hilda has really nailed that point. And the term I would use is framework, that we really need a framework to help people develop the language, the understanding, and to scaffold skills onto this framework of emotional intelligence, or EQ, emotional quotient. So if parents are able to begin to talk to their kids about emotions, that would really help lay a foundation. Unfortunately, a lot of parents tell children, don't be angry, don't be upset. And that almost invests emotions are bad, they're wrong. When children feel something very strongly, Parents often say, calm down, don't feel that way, you're getting emotional, like it's a bad thing. And so unfortunately, the message is to suppress, deny, ignore, just stuff those emotions.
Todd, are you still there? I think we had a, I don't know if it's just me, but I think he has been a bit cut off there. Is it just me, Dr. Hilda? Do you hear him?
I can't hear him either.
Yeah, okay. It's all right. Let's just go with time. Hopefully we can get Todd come in a bit. If I can just have the organizers to just check in with him just to make sure he's okay. But that is a good point in spirit, Todd, to share that there is a framework that required, especially in the thought process of how we can build emotional quotient as a culture from as a child to those who are actually currently working in a professional space, which I really want to appreciate that point by Dr. Hilda. Oh, I see he just exited that. It's okay. We'll just come back to Todd in a bit. I also want to also acknowledge there are some questions that just came in about different approaches that we're seeing here. That those there are those who are struggling to do this whole exercise together with their parents. So that's some stigma that we need to address. And there are those who are struggling in the context of the COVID pandemic, which I really want to emphasize as a point because of the support services maybe is quite limited. And there are others, other quite more contemporary topics, which if we have time, we'll go to that. But otherwise, I'll see where the audience is coming in a bit. Unfortunately, I still don't see Todd. So I'm just going to open this to F. Arifa and then see if Dr. Hilda can manage his conversation. And I'll just repeat the question to Todd when it comes in. F. Arifa, are you there? Assalamu alaikum.
Walaikum salam. Am I audible?
Yes, I can hear you loud and clear. If you can just introduce yourself and share with us what you'd like to have today. Nice. It's nice to see you on camera. Thank you for joining us. And I love that halo there at the back. Arifa, please.
All right. Hi, everyone. Good morning, first of all. And my name is Arifa. I'm a second year student at UBD. So my interest in mental health peaked when I took psychology during A-levels. I've always been interested in it, but A-levels just kind of provided that platform for me to learn more. My question is, so I am a Malay person in a predominantly Malay family, and I understand and I acknowledge that there is some stigma and how mental health is viewed as taboo, especially in the Malay culture. So with my parents' generation, it's always shunned in, and it's not very openly talked about. Even if it is, it's always linked to, you're not praying enough, or you should pray more. So my question is, how can I have a healthy discussion with my parents, or for anyone that is concerned with this? Because I do understand that there are parents out there who are still close-minded about this topic, and oftentimes their knee-jerk reaction is to be angry or be frustrated with their children opening up. So I just want to know how to navigate this territory, this very scary territory, and to just healthily discuss with my parents and kind of, I don't want to say avoid, but deal with whatever scrutiny or misunderstanding that may be headed my way. That's all. Thank you.
Thank you, Farifa. I see a sudden surge of two hands there from Ms. Mariam and Ms. Amy. I would also highly encourage to hear and see if there are any men in the room to share some of their own experiences as well. I'd love to see some gender balance in this engagement, as well as as the experiences might differ, maybe. But I'm very proud to present the male population today. In any case, I know Todd just came back in. Welcome back. I think you have shared that you've sufficiently shared your question. I also want to also kind of tie in here before I introduce the other two. Dr. Hilda and Todd, I think, really discussed about how we can start with key questions, a framework of sorts, where we can tackle that on. And I know we've seen a recurring question here on how younger generations can manage communications with their parents. And I think that's a really good perhaps case study or context where we can approach that as well. And we'll see how this diverges with our two lovely participants who are coming in. Miss Mariam, if you'd like to come in, if to introduce yourself and just sharing what you have to say. Assalamualaikum, silakan.
Waalaikumsalam. Thank you for the opportunity. I actually wanted to add more on what Miss Arifa had said.
Mariam, could you introduce yourself?
Can I be heard? Hello?
Yeah, I can hear you. I can hear you. I just want you to introduce yourself.
Oh, sorry. Thank you for the opportunity. My name is Mariam Sarkawi, and I'm currently working as a tutor in tuition school. And I just want to support what Miss Arifa had said regarding about the older generation and how we as the younger generation actually see them struggling with mental health, but them unable to actually acknowledge such existence, and us being their children are ourselves also struggling to help them in ways that we can actually help. For example, we are already we are already being introduced with lots of tools in our toolbox when it comes to how to manage our emotions or our mental health. But we found it very difficult for us to actually share these tools with our parents or older generations in order for them to actually achieve the similar mental stability as us. That is all.
Thank you, Mariam. We'll just head straight to Amy. Could you just introduce yourself and share your point?
Hi, Assalamualaikum and good morning, everybody. I'm not here to share some of my point, but actually I have a question, if that's okay.
Yeah, okay. Could you just introduce yourself if you haven't already?
Okay, so my name is Amy, and I'm actually an educator at one of the government secondary schools. Okay, as an educator, there's you have a lot of responsibilities actually, and also one of my main struggle is actually whenever I listen to kids, right? Because I have kids with different backgrounds, different family backgrounds, coming from different backgrounds in general, and also whenever I try to help them, it's at the end of the day, it is always me who get so absorbed with their stories and their emotions. I mean, like, as much as I want to help them as an educator, but at the end of the day, it eats me up inside. So I'm not sure how to handle that actually. So yeah, so that's it I have for now.
Thank you so much to Amy and Mariam. I love that this is more of a sharing of experience, but also Amy that gave a good question about how to, I guess, share these internal struggles we have as well. And I can relate to that, Amy, as a professional working from home, apalagi with and recognizing the struggles within the education sector as well. I'd like to open this floor to Dr. Hilda and Todd. I see another hand raised there from Michael, so I will come back to you in a bit. Thank you for representing the male population. Dr. Hilda, maybe I'll open the floor to you first.
So I'm hearing a lot about intergenerational struggles and difficulties communicating with your family members. And first of all, I want to commend you for admitting it, for saying that this is a struggle. And I think that's the first step, that as a community, we need to acknowledge that there is a problem with communication between generations. And I see that in our clinic a lot. A lot of young people come in and say that their parents don't understand them, or when they're trying to explain something to their parents, they feel shut down or invalidated. They're told, don't feel that, I think, which is what Todd was explaining. But I feel this. Well, don't feel it. Well, that's not very helpful because you are feeling it and you're looking for help to manage it. So I think, this is a big struggle, and it occurs in many, many families, including mine. How do you deal with it? Well, I think it's a very difficult struggle. I think to start off with, by admitting that there is a problem, that people need to be honest and say, we have a problem. We do not communicate with each other adequately. Now, if you are faced with family members who do not wish to communicate, who just can't face it, and some people are not ready. So you can't have a deep communication with people who aren't ready. It could be that you cannot have that conversation with them, and you might have to find another trusted source. So there are some circumstances where you could try gently, and you try and ask them to please understand what I'm going through. And after all, if they're your family member, presumably there will be some affection and love and concern there, that they would listen. But if you find that after trying that it just makes you feel worse and you're not able to communicate, it is possible that that person is not ready. And you might have to find an alternative trusted source. Now, often when I speak to parents about this issue, I'll say to them, wouldn't it be dreadful if your child has an issue and they go to somebody else to talk about it and you have no idea what's going on? Wouldn't that be terrible for you, that you do not know what's happening? So I think as parents, we have to come to a realization, and I'm a parent, that if your child is struggling, you really want to be the first person that your child goes to. You do not want to be the person that your child tries to speak to, and then they find that you just make them feel worse and they shut down and go to somewhere else, because who knows where they're going to go to. So I think it's something that parents need to think about as well. Now, if your parent is struggling from a mental health problem, and I also understand the situation, there is a sort of power imbalance, isn't there, in our culture, where if you're older, you're therefore right. And you can do no wrong, and the younger person has no say. That is a power imbalance that's in our culture that is often unhelpful, especially if the older person needs help. And again, the only advice I can give you is to try to communicate sensitively and to try and have a discussion with them. You could try and recruit other family members to help you, because you will need support as well. But I have no easy answers to this, because it is clearly a very difficult area. Which brings me to the last issue, the last person who shared that they're a teacher and they find it difficult because they listen to all these problems that their students have. And so you see, we're getting an idea of how complex these problems are and how difficult these issues are. I remember when I did my training, many of my colleagues didn't want to do psychiatry because usually they can treat a patient in 10 minutes, but if it's psychiatry, you're there all day. There are so many issues. As you keep opening, there are more and more layers. So I think we're getting a sense of how complex and how all-encompassing these problems are. But we can also understand that many of these problems are due to communication and whether you're willing to open up or not. Perhaps Todd has more to say about that.
All right, well, it's good to get this mask off. We had a film crew here for a moment, so now they're gone. Yeah, I think Dr. Hilda said some really salient points about that it's a real struggle to sometimes open up to family when you're going to feel judged. And I believe many parents maybe see it as a reflection of their parenting. If their child says, I'm having a hard time, I'm not doing well, I'm not okay. And they might get very defensive about that. They might also see maybe talking to a therapist as a betrayal of family or family secrets. So there's a lot of reasons why parents may not want to be open or able to listen. I think somebody made a really good point in the chat that maybe education can help. If you can go online, if you can find some really reliable, credible sources of information and maybe share that with your parents, they might be willing to listen. If it needs to come from a perspective that they're going to understand, maybe a religious perspective or another authority that they would respect, try to use that. When you want to talk to family members, make sure you don't blame, make sure you don't attack, don't make it about them. You know, it's really important to go in and say, I have a problem. I'm struggling. I really would like your help. Can you help me? And that invites people to listen, to want to be there, and reduces their defensiveness around a very sensitive issue. And if you want to have a conversation, perhaps go prepared, make notes, understand what your objective is, write down your key points, and treat it a bit like a business meeting. So I think there's some ways to maybe make it a bit easier, but it's still not a simple thing. To segue into the question about what can educators do when they feel overwhelmed, when they don't know what to do, again, there isn't an easy answer to that question. I think what's important is to realize you have certain parameters, that certain things are in your control. You're responsible for only a small area. And if something is out of that area, you need to hand it over to somebody. And you can't manage a child's life. You can't make everything go perfectly for them at home, on the playground, socially, as much as you would love to. So you really need to think, okay, where do I exert influence? Let me manage that. What's outside of my control, who can I hand that over to? What professional, what authority can I pass this to and trust them to take over from there? And just know that you've done your best. Give yourself a pat on the back for that. And that's all you can do.
Thank you, Todd. Thank you, Dr. Hilda. It is one of many, I think, things that one could only do. I think you've given a good thought process on laying that groundwork. Of course, this conversation is just perhaps just a minuscule of what we all can do. And as I've mentioned in the chat box, if that's something that we can look into more further, whether it's from an educator perspective or a student, I would love to see how we can engage this conversation after this event. Of course, we have a 3-week program as well, and seeing how we can also take these takeaways from Dr. Hilda and Todd, see how can we can do that better, whether it's in support groups together as a community or to interact with professionals. I still note there is still a hand raised there, Michael. Let me just pivot away to the Slido questions here. I think we've seen a nice discussion cross-cuttingly from talking to institutions, looking at curriculums, whether or not we should introduce one or how we can introduce it, to those who are looking at an individual level, as a child to a parent, of how we can manage this sort of communication. To those who are looking at a social cultural level, being with different types of fear or expectations, look, I think as Todd put it, or was it Dr. Hilda, that speaking to a psychiatrist is a betrayal. And I think that is something that was rooted in me personally at one point as well. If I could just look at the questions just for a bit there, tying back to the theme, mental health in an unequal world, excuse me. We have had a number of questions looking at different socio-economic levels, those who may not have access. There may be conversations about, oh, I want to go to a private clinic, but I can't afford it. I know there are also public services, but there's also a fear of confidentiality. Those are just some of the questions there. And I think even looking at different mediums that could be presented. I also note there are some other questions that are coming in. So that's just one point. Looking at different socioeconomic levels. The second one is looking at issues and malpractice, especially Master COVID in the context of the pandemic. People are looking for more services. How do we know that the professional we are looking at are credible? There's also the source of internet, there's social media, and cope with physical symptoms. I think fatigue, shakiness, pins and needles, and identify how someone has mental health. So these are just 3 points. I'd like to just open this to Dr. Hilda and Todd, and I will come back to another round of live questions from the audience. Dr. Hilda or Todd? Dr. Hilda, would you like to speak? I see your mouth.
I was going to say perhaps Todd could go first.
Todd, please.
Yeah, I can definitely go first. Can you try to recapture that question? I'm not quite sure I got a pin on it.
So the first point is looking at how we can provide different access for people in different socioeconomic levels. So I think what we want to share here is the resources that are available. We know there's the Talian Harapan, but how about private sector? How about the public sector? How do we reach out to the right mental health resources online? I think the other point that I was also looking at is another point of avoiding misinformation or disinformation, what you shouldn't look out for, and how can we use information to support each other and along with these resources. So those are just the 3 key points, if I phrase that correctly for you.
All right, that's great. Yeah, I guess one of the important things to do is to increase accessibility to mental health services, mental health supports. So what I've noticed happening is that schools are working harder to have more and better counseling services available. So I think that's really important. This is where children spend a significant amount of time. This is where a lot of issues stem from, in fact. So I think having more counselors in the schools, having better training, greater development is a really important aspect of that. I know it's happening in the secondary educations. I meet with the counselors from post-secondary. So there's some really wonderful people working really hard to make a difference. I know there's some new training getting set up within the Ministry of Education to better support educators. So that's really important, is to provide access to people at school. The other, I guess, way that people can access is often through the workplace. One of the things more and more companies are doing is implementing supports for their employees, maybe employee assistance programs. So employees can make appointments with a private institution offsite and go get support, and it's paid for by the company, and it's confidential, it's anonymous. So in that way, employees they need. There's a lot of companies in Brunei that are doing this now. BSP has been a front runner, and I think Hajja Zainab has been really important in that. They've set up a helpline. So they, for example, along with some other organizations, have done a brilliant job at increasing the accessibility. And then, of course, there's the government side. And I'd probably be better to leave that to Dr. Hilda to talk more about what the government is able to do and can do. All right, so that's the first part. I'll stop there.
Hi. I think that forums like this are particularly useful because it highlights how much need that there is. And I think that is useful to show to the people who hold our purse strings and who provide services. I remember when I started 10 years ago, I was told that if anyone had a mental health problem, they were just told to go to RIPAS, come and see one of us. Yeah. But really, what we're talking about is not just mental illness, but people struggling with mental health problems, which is a different matter. Everybody struggles, right? So, I mean, for example, during COVID, everyone has a level of anxiety. Will I get infected or not? and so on. So not everybody needs to go and see a consultant psychiatrist in REPAS, which is in itself quite intimidating. So what we really need is lots of people on the ground who can provide, for example, psychological first aid or support. And that's really what Todd's been talking about in schools and in workplaces. There has to be a service where people can go for support before things get too bad. And it is encouraging to see many private companies and also schools implementing this. In the government service, there is a counseling service that is available from the JPA, but also, many workplaces now are more and more aware of this. But what I have found is that we are still telling people to go and seek specialist services, like a consultant in mental health and so on. So I think that there is greater awareness and greater understanding now that there is more need for help on the ground. And I would be keen to see more and more of this because it's absolutely necessary. And we've seen even from this forum with less than 100 people, how much need that there is. I don't really have all the answers. And I understand and I'm feeling the struggle that people are experiencing. And just from reading the comments and from hearing people discussing this, I understand that some people are in a lot of pain, some people are really lost, and some people struggle to seek help because they have issues of trust and confidentiality. And I guess all I can do is to acknowledge your struggle. You are struggling, people do need help, and you have had difficulty. And as a society, we need to have much deeper conversation about how we can provide help and support to everybody who needs it. And we can see how unequal this is, that people are struggling alone and do not have access to the support and the help that they want. So I acknowledge what you're saying, and I understand that there's a lot of need and pain out there. And really, as public and private sector, there is a lot more we could do. A lot of this has to come from people wanting these services, not just from the top down, but from the bottom up. Thank you, Fadli.
Thank you, Dr. Hilda. Todd, would you like to continue on? I think there are 2 more points there. So if I could just phrase that correctly, is the addressing malpractice. If I can just add an example here from a question, there are also self-claim counselors or therapy theories. There's even a suggestion. There's even a suggestion here. Although I think I'll pivot on that later on, but I think just generally addressing malpractice and how can we address that? Todd, please.
Yeah, I guess the onus to some degree is on the individual to make sure that when they seek help, they ask the question to help guide themselves to get the service that they need. And most people wouldn't know what questions to ask. So I think if you're looking for support, it's really important to be clear what you think you want and to ask a professional, what is your training? What is your background? What are your credentials? How long have you practiced? And it's absolutely vital. It's important as a consumer to ask these questions. Very few people ever ask me these things. They might wonder, but I suspect they feel, concerned or don't want to offend me. So I always try to tell people these things. But yeah, it's important to ask the questions to make sure that whoever you're seeking help from appears to have what you need. You can also check credentials. You can ask, where are you registered? Who are you? And you could probably go and get a list of their members and check that out.
I would,
and with
if
regards,
I could add,
yeah.
Sorry, so if I could add to that, so the healthcare professionals working in Brunei have to register with their respective boards at the Ministry of Health. So you can actually check that. And you can actually go to the Ministry of Health website and check the list of registered members. So for example, all doctors are registered, psychologists are registered with the Allied Health Professional Council, I think. So you can have a look and see where your practitioner is registered. We do not currently have a situation yet where all the qualifications are on the website, but as Todd said, you can always ask, and you could even ask to see evidence of their qualifications.
Yeah. And then unfortunately, the internet has been a bit of a mixed blessing. It's got the dark side, and there are websites out there, you know, focusing on suicide and almost encouraging people to explore this, cutting, eating disorders, and they almost become celebrated in some cases. So it's really important to be careful where you get your information, what websites you look at. Instagram, Facebook, you know, TikTok, they're full of things. And I would just say, before you share, just verify, check. Don't believe everything you read. A lot of it is just repeated and not necessarily true. I hope that touches on that for you.
Thanks, Todd. Thanks, Dr. Hilda. Maybe just one last note that I think in the mesh of the 3 points that I've shared before we open another round of questions. So we welcome the audience to come in and sharing that as well. I think particularly important, and tying in the theme with mental health and equal world is also COVID. I think Brunei is currently facing the second pandemic. Are we looking at public and private services that we can access virtually? We know there is a Talent Harapan, but are there other mediums or even website resources they can just access to? I think some of the questions that was actually addressed is like how do you identify a mental health problem, especially in a very isolated way coming in at home, and how can we address different not typical problems, but those while facing symptoms of self-isolation, and how do they cope with that? Dr. Hilda or Tom? I see Dr. Hilda's mic.
There's I've just left my mic permanently on because I keep forgetting to turn it back on. There is a lot of information out there. I mean, we are all quite isolated, and we're all, connected on our phones and on our devices. So, like Todd says, the internet has good and bad information, but there is a lot of good information out there. Some tips I'd like to give people is when you look at an internet website, you want to look at the ending. So if it's an official website that belongs to, for example, a Royal College of Psychiatrists in a country, or a government website, it usually ends with .org, .org, or .ed.uk, something like that. If it ends with .com, it's probably a blog. All right. So you need to learn how to discern these websites, and you want to see whether these websites are bona fide and whether they come from official channels. If you do look at a website and it's an official channel, for example, the Royal College of Psychiatry website in the UK, there will be a lot of information about self-help, lots of leaflets, and they'll explain different conditions to you and how you can check whether you have these symptoms. And again, there are many other websites like that. There's a wealth of information on COVID and mental health related to COVID. So there's the CDC website, the Center for Disease Control website. I've had a look at it recently, and I've used some of their materials. So there is a wealth of information out there that you could use. Just be very discerning on what you're reading and check that it comes from an official website. In terms of seeking support, many of us will already have our existing support networks. Most of us have a few good friends whom we can contact. And I would encourage you to use the network that you have, just to chat, just to check. And when you're on your own, you need someone to check your reality with you, right? Because if you're by yourself all day, I know this for myself. my view of reality is altered. I mean, all I need is 2 days on my own, and I need someone to check things with. So you need someone that you're close to. You need someone that you can confide in, who can check up on you and check up on each other as well. So I would encourage you in this time to use the existing network that you might have. Talian Harapan is our most accessible service. You just press 145 between 8 a.m. and 11 p.m. and there will be a trained operator there who can talk things through to you. But I do acknowledge that in this COVID time, many services are very limited. There are apps that you can use or on your phone or on your devices. They can talk you through anxiety, for example, and relaxation techniques. So they can be very useful as well. With regard to getting therapy online, I'm less experienced with that. So I'm not sure how to advise you on how to find a good therapist who might be in another country online. I would probably advise you to use one that's available locally because they are registered locally. And if there is malpractice, then action can be taken locally. Yeah, that's my input.
Thank you, Dr. Hilda. Thank you, Todd. And to the organizers, yes, I'm getting bombarded messages of the questions that there aren't answered. So please please trust that I am trying to moderate as best as possible. In any case, I appreciate the resources that has been shared there. Timely enough, I think this forum is also opens a 3-week program of different workshops and focus groups. And this is a really good test bed for those who aren't really sure how would that process could take place. So this is a really good place. We've made strides and efforts to make this a responsible event with, as Dr. Hilda, Todd, and even Fauzia shared, to make sure that these are accredited mental health professionals that are here just for you. I am opening another round of questions live on the mic. Michael, thank you for staying on your hand raised there. I am also encouraging ladies and gentlemen to just share your own experiences as well. Being mindful of time, this might be the last round depending on the responses that we'll have here. And yeah, please raise your hand once again. Michael, are you on the other side of the line?
Yes, I am. Thank you.
Hi, Michael. Thank you for joining us. I think you are in the UK still or back in Brunei?
No, I'm back in Brunei now.
All right. Very good morning. Thank you once again for joining. I note that we've enjoyed the support from Ayan Brunei and being involved in a wealth of events. And thank you for your contributions over the last month. Seri, and your signature poetry that does end every time. Michael, I'd like to open this floor to you and introduce yourself and your question and sharing session, please.
Thank you, Fadli. And I am answering your call for gender balance. In my former life, well, in the last year or so, I've been involved with setting up a well-being team in the UK for Bruneian students. We call this the well-being team, and I was this was set up back in August 2020, and my focus here was to increase mental health awareness among Bruneian students in the UK. But we were quite clear in the sense that we would provide mental health awareness, we would provide this inclusive atmosphere, but we were quite clear that our job was to signpost people and not to provide help because we don't have the necessary expertise. So now my question goes on to NGOs. We have the wonderful work by Hello Hoku, More to Bloom, Cope for Hope, etc. But how can we as NGOs complement the effort of mental health awareness while noting that we don't have the necessary expertise, but at the same time wanting to provide a platform that is inclusive, that is one that is sensitive, and one that knows our boundaries and what we can do and what we should leave to the professionals. So what are your, what words do you have for NGOs, especially in echoing that idea of this ground up movement?
Thanks, Michael, for that. I am just opening once again any live questions or sharing of experiences on the mic that anyone would like to share in our last 10 minutes or so before we end the first forum of the session. I also would like to acknowledge and thank you some of the questions that are coming in. I understand some of these questions are more on the contemporary topics, looking at inequality in different areas. We'll see how we can phrase that accordingly. I also know there will be some resources for the next 3 weeks, just in case you're curious about what other 3-week programs are coming in. In any case, I still don't see any hand raises here. I'll just open back the floor to Dr. Hilda and Todd. And then I'll see how I can share maybe a few more questions or any points that I've been flagged to before we conclude the session. Dr. Hilda, Todd, floor is yours.
Sure, I'll try to speak on this, although I certainly don't know that I would maybe have an answer to that question. So how does an NGO not cross boundaries, or maybe get into areas where they're not qualified? I guess the important thing would be for an NGO to really consider their scope, not try to be everything. And fortunately, there are a lot of different NGOs. So if you focus on, what exactly is your niche, what is your objective, and try to deliver that and only that. And I think the problem is you might notice needs that aren't getting met, so you want to kind of creep into that and creep into more things. But just keeping yourself limited to what do we do, what are we good at, where does our expertise lie, stick with that. If somebody has needs that are outside that scope, know your referral sources. So have a good, thorough, comprehensive list of who do we direct people to when they kind of fall outside of our boundaries. And the other point would just be to involve professionals, get their inputs, get their thoughts, and just help, get help from them to know what you're doing, what you shouldn't be doing, if that's at all useful. So I hope that's somewhat helpful.
Thanks, Todd. Dr. Hilda?
Well, first of all, I'm quite excited that there are NGOs in Brunei working in mental health because I remember when I started 10 years ago that we were struggling to find partners who would work with us. So I think it's great that there are so many NGOs and so many groups and people willing to take this on. Like Todd says, boundaries are important, and you need to know what your limitations are, what you can and can't do. So I think you should have at least a vision document and a document that states what people can and can't do. You need to be careful when you recruit people. Usually in other developed countries, you have a police check because you need to make sure that people are genuine and are there to do good. So your selection process should be very carefully done, especially if you're going to work directly with people who have mental health issues and with children and vulnerable people. But if you're just doing work where you're doing promotion, mental health awareness, publicity, I think that's easier. So boundaries, and also, like Todd said, you need to know who you can refer people to. So you need to work hard to make connections and to find a network of people. You need to understand that you can't serve everyone with everything that they need, and therefore you need to have a network of people who can support you, who you can move people to. And the other thing that I would like to emphasize is you need education. So in an NGO, you need to have a vision of how you're going to upskill and how you're going to equip yourself to deliver the service that you want. So that's it. Boundaries, a network of support, and education, upskilling, and also making sure that you have the right people in your organization.
Thank you, Dr. Hilda. Thank you, Todd. I'm mindful that we would like to end before the Azan prayer, so that will be at 12:08 in Brunei Muara. But I will also just would like to make sure a final round of questions from the live mic on the audience. In the meantime, I'm going to just review back some of the questions on Slido. My deepest apologies. Oh, I see Ayuni has raised her hand up, but let me just double check with anyone else who would like to share anything. I am also mindful that we may have not answered all the questions, but we would like to see how we can synthesize and share these questions with our partners so that we can see how this could materialize in programs or initiatives that we may have not already considered together with Dr. Hilda and Todd. Let's see. Okay, I don't see anything else that someone has liked. Ayuni, you have the floor. Thank you for the hand applause, Puan Zainab. Anyone else for the final question, final word? Ayuni, please. The floor is yours. Please introduce yourself as well. Yeah.
So I'm Ayuni, and basically I'm live from Kampung Kelapis. So I would like to just share my personal experience. So I used to study abroad in London, and unfortunately at that time it was also national lockdown in London. Unfortunately also at that time, I don't know who specifically that I need to reach to for my mental health. I wish that there could be a platform provided specifically for Bruneian students abroad to talk about this freely. Maybe this can be something to be considered in the future, especially to help for people who is not comfortable to just reach like some friends they just met at that time. So yeah, because from my personal experience too, I tried to do a research to reach out like therapies specifically from London due to different time zone and all that. It's quite pretty expensive and it's really out of budget for a student. So I really hope this could be something to be considered that to be provided like in the future for this platform, especially to take care of mental health for students abroad, studying abroad. So yeah, that's all.
Thank you. So that's one perspective there for a mental health student from abroad. Yeah, I think we'll just address that as the final question, I suppose. And once again, for the questions that may have not been answered, we'll just channel that through the workshops and focus groups that Camelia just posted up. So do check that out on Eventbrite, gscpsp.eventbrite.com for the continuity. I'm going to pause there. Back to Dr. Hilda and Todd for the final response.
Thank you for that. We are aware that many students struggle when they go overseas. It's a bit of a culture shock as well. First of all, I mean, I studied in the UK. Most universities have a counseling service for students, and most universities also have an international student association. So you can usually access counseling services there. With regard to whether MOE can provide some sort of counseling for students overseas, I think it would be helpful if Michael or other people who are in an organization could collect data on how many students need this help. You could do a Google survey, an anonymous survey. How many of us would need this help and how many of us would want this support? And then you need to make a case to MOE and say, look, 90 out of 100 students said yes, they struggled with their mental health and they needed support. So please, could you provide us with something? So, when you ask for services, you usually need some sort of data and you need to demonstrate that there is a need for this kind of service. And of course, preferably you would want a service that's anonymous, that's confidential, because you would be fearful of the impact on your education and on your scholarship. So I think, a case has to be made. It is difficult for me to make a case for you because I do not know how many of you struggle and how many of you would want this kind of service. And of course, any service would have to be tailored to you. So I think that if there is an organization, like a students' organization, a well-being organization, it is necessary also to collect some data and to make a case for what services that you would need.
Thank you, Dr. Hilda. Quickly, Mr. Todd, please.
Yeah, I think Dr. Hilda has made the point brilliantly. What I've found is that just in my experience, many students who go abroad really do struggle. Oftentimes they get into really bad spirals of anxiety where they're late for an assignment, then they start missing that class, and then they start missing more classes. They withdraw, they spend all their time in the bedroom. They just get into this really negative cycle. They end up dropping out, returning home. And then there's the shame, and it can become a really difficult thing. And so I think having support is really, really important. And Dr. Hilda described some great ways to access what's there and perhaps make a case for some new services. And I think maybe Brunei Hall or other places could start to collect that data and advocate for that. Another population that I notice that struggles a lot is students returning home. So they may have gone abroad, they may have had their independence, their freedom, been able to question things, critically think, learn best practices, and then often come back and are, in the family home where they're more controlled and told what to do. They get into a job and their boss is telling them, this is the way it is. I don't care if you've learned something better. This is what you need to do. And so that can also be a real struggle. So I would encourage people to be aware and acknowledge that, even if you survive studies abroad, coming back is often a very, very difficult transition, and do get help and support as you need it before things get worse. And that's one of the keys I think of today is, like was already said by Dr. Hilda, we would like to work with people before they develop a mental health disorder. So it's okay not to be okay. And when you're not okay, seek that help.
Thank you, Todd. Thank you, Dr. Hilda. That's a final round of questions. And ladies and gentlemen, thank you for staying with us so far. I would like to give the final word to both Dr. Hilda and Todd, and then I'll just come in just to wrap up the session, being mindful of time as well. Dr. Hilda, Todd, we've had a wonderful conversation of looking at different, very variety of areas, really. I'm looking at identifying both challenges and opportunities, looking at the current landscape based on the participants' questions, actually. Maybe what I would like to hear from you more is on how would you like to see this moving forward in just a few general remarks, maybe for the next minute or so, and then we'll go to Todd. Dr. Hilda, ladies first, please.
Me first. I would love to see more honesty amongst people. More openness and more acknowledgement of what as a community we have been going through, and what our individual struggles have been, and more acknowledgement of what other people's struggles have been. I think that's the first crucial step: honesty, openness, and just a willingness to speak, and crucially, a willingness to listen. Because most people come to me and they spend an hour in my office because there's just no one else to listen to them. So I think we could start with that. When someone comes to you, just listen. And actually, most people don't want a solution. They just want you to listen to them. So I think we could start with that, an honest, open listening society. That's what I hope to see.
Thanks, Dr. Hilda. Honesty is a good key with that. Todd, you have the final word.
Yeah, I guess for me, I've just been blown away by the grassroots kind of bottom-up drive for change, especially among young people. And I suppose in addition to honesty, what I'd love to see is a willingness to change. And what I get struck by, particularly doing so much work with organizations, is the number of people dealing with stress at school or stress at work and telling me that their company is unwilling to change. Their line manager is like, well, it was tough when I was young and it's going to be tough for you. And, I survived that baptism of fire. My mental health suffered, but I'm okay. So I'm going to put you through the same thing. And I think that really needs to change. That maybe the emphasis on top grades, maybe the emphasis on being tough managers, those changes really need to begin to occur so that everything the schools do, everything that companies do, is always met with the question, how does this help? Or how does this support the mental well-being of the people here? So I'd love to see a willingness to change.
Say thank you so much to Dr. Hilda and to Todd. Let's give them a round of applause, give them some reactions, give them some love on the chat box. It's been a wonderful and an insightful last hour or so of actually getting in this conversation. I do want to take note that there is a feedback form. Please share your feedback as we would like to improve our upcoming events in the next 2 weeks. Thank you for the applause, everyone, ladies and gentlemen. I just would like to just share this one bit, and then we'll conclude the session with a dua. I think we're looking back to the topic of this conversation is on mental health education and its realities. What you guys have participated is a whole exercise for us to tailor our sessions better in the next 2 weeks. So before you leave, your feedback is really important, and the hyperlink that has just been shared, and an Eventbrite participation that you will have in the next two weeks as well. If you could just allow me just for last few seconds, I think it's really interesting and important with the few key takeaways that we've had, and thanks to the team that's just been note-taking in the last hour or so with the issue of inequality factors, social standing, age, financial, cultural differences, people looking down on mental health issues as well. Lack of emotive skills, that's also one other note that I've really noted in the earlier conversation we've had. Awareness on these issues is a start of change, especially in the context between parents and children. And educators, acknowledging the plight of educators, of understanding and their effect in mental health and how they can seek professional help as well. Just last 2 points, like accessibility of counseling services. That's really important. A lot of companies right now are equipping their employees with external support groups and counseling services. Todd really put aptly with an example by BSP when signed up with the movement they've had in employee relations. And last but not least, the misinformation online regarding solutions to mental health, bad eating disorders and whatnots, finding the right information. And on those final 2 words, remarks that Dr. Hilda and Todd shared, honesty and empathy, I think is one or two things I think I will keep in mind personally on how we can tackle on the different levels we see, institutional, social, cultural level, individuals, and that's it. And hopefully we've tied in the team and achieved the objectives. Ladies and gentlemen, I'd like to once again thank you, Dr. Hilda, the Ministry of Health, Todd McPherson of Clarity Sendirian Berhad, for having this wonderful conversation, not just but with you, every single participant who have stayed in here so far, and those who are joining us online via YouTube as well. It's been wonderful for me to cater this conversation with you. Especially as we celebrate the mental health, not just today, but every single day, and supporting each other. It's been wonderful. Been a wonderful morning. And I'm just checking with our organizers if we have anything else to share. And I've been requested to conclude on behalf of the MC. Is that correct? I think also one note, we would like to thank you, Mr. Farid Idris of Royal Brunei, for catering his services as the master ceremony for today. And our lovely committee team who had been involved in the background, and there's too many names to share. So let's just give them a warm round of applause together with our partners, our sponsors, and the committee team that have been put in a wonderful sharing session today and the next 3 weekends, which I am very, very, very excited to look forward to. I will remind myself there is a dua. So I'll just introduce the dua so that we can conclude the session timely. So let's stay and conclude the session together with a recital together, and then I will just say our final goodbye. Dialalukan membaca doa for just to conclude today's session, please.
Amin ya Allah, amin ya Rahman, amin ya Rahim. A'udzu billahi minasy syaithanir rajim. Bismillahirrahmanirrahim. Alhamdulillahi hamdan katsiran tayyiban mubarakan fih, mubarakan alaihi kama yuhibbu rabbuna wa yarda. Allahumma salli wa sallim ala sayyidina Muhammadin dhil qadril azim, wa ala ali nabiyillahil azim, wa ala ashabihil azam. Allahumma inna nas'aluka bi'allaka alhamdu la ilaha illa ant, الحنان المنان بديع السماوات والأرض ذو الجلال والإكرام يا حي يا قيوم. اللهم ألف بين قلوبنا على الخير وأصلح ذات بيننا واهدنا سبل السلام ونجنا من الظلمات إلى النور وجنبنا فواحش ما ظهر منها وما بطن. اللهم رب جبريل وميكائيل وإسرافيل فاطر السماوات والأرض عالم الغيب والشهادة أنت تحكم بين عبادك فيما كانوا فيه يختلفون اهدنا لما اختلف فيه من الحق بإذنك إنك تهدي من تشاء إلى صراط مستقيم. اللهم بارك لنا في أسماعنا وأبصارنا وقلوبنا وأزواجنا وأرزاقنا وآرائنا في مجلسنا هذا وتب علينا إنك أنت التواب الرحيم وجعلنا شاكرين لنعمتك مثنين بها قابلين بها وأتمها علينا. اللهم إنا نسألك خير هذا المجلس وبركته أوله وخير ما بعده ونعوذ بك من شره وآفاته أوله وآخره وما بعده. اللهم إنا نعوذ بك من شرور أنفسنا ومن سيئات أعمالنا. اللهم أرنا الحق حقا وارزقنا اتباعه وأرنا الباطل باطلا وارزقنا اجتنابه. اللهم الطف بنا في تيسير كل عسير فإن تيسير كل عسير عليك يسير. اللهم طهر قلوبنا من النفاق وأعمالنا من الرياء وألسنتنا من الكذب وأعيننا من الخيانة فإنك تعلم خائنة الأعين وما تخفي الصدور. اللهم إنا نسألك بأسمائك الحسنى وصفاتك العظمى وكلماتك التامة أن تلحظ بعين عنايتك الربانية وتحفظ بحفظ وقايتك الصمدانية كبوah duli Yang Maha Mulia Paduka Seri Baginda Sultan Haji Hasan Al-Bulqiyah Mu'izzuddin Wad-Daulah Ibni Al-Marhum Sultan Haji Umar Ali Saifuddin Sa'adul Khairi Wad-Din Sultan dan yang di-Pertuan Negara Brunei Darussalam. Allahumma fazhu fi nafsihi wa ahlihi wa awladihi wa ra'iyatihi ajma'in. Allahumma adimhu mutamatti'an bitulil baqa متوجا بتيجان الصحات والحنى. اللهم عدل عمره مصلحا للموظفين والرعية والبلاد وبلغ مقاصده لطريق الهدى والرشاد. اللهم اجعل مملكته negara Brunei Darussalam ma'muratan bittaqaddumi wassalam wal adli wassalah wal barakati bainal anam wal raqa'i wal amni wan nasri wasaira biladil Islam. اللهم اجعل جمعنا هذا جمعا مرحوما وتفرقنا من بعده تفرقا معصوما ولا تجعل اللهم فينا ولا معنا ولا من يتبعنا شقيا ولا محروما ولا مطرودا. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. وصلى الله على سيدنا محمد وعلى آله وصحبه وسلم والحمد لله رب العالمين. تقبل الله منكم.
Amin, amin ya Rabbal Alameen. Taqabbalallahu minkum wa minkum ya Kareem. To Dr. Hilda and Mr. Todd, please feel free to share your contact details on the chat box so the participants know how to get in touch with you. Just that one last note I'd like to just share. And as well, ladies and gentlemen, I think I've shared my thank yous. I think coming from myself personally, thank you for having me. And I hope everyone is doing okay. And I hope everyone is coping well in this pandemic. I think I'm just practicing the key takeaways that I've just learned from our speakers. And with that, I think we've had a nice group photo, so I think we will share that accordingly. And I think I'm just looking for any final announcements from our organizers. No? Okay. I think with that, wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. It's been a pleasure. Fadli signing out. Goodbye. And have a wonderful weekend.
Thank you, Dr. Hilda and Todd and Fadli. Bye, everyone.
Thank you,
Thank you,
Shah.
everyone.
See you guys in the next few
Thank you,
events.
everyone.